Well, Dr. Mark Goetting is with Bronson Sleep Health. He is the medical director of sleep at Bronson. Dr. Goetting, good morning.
Good morning.
You guys have sleep centers all across southwest Michigan, don't you?
Yes, we do. As far west as South Haven and as far east as Battle Creek.
Yep. Just head down M66 there to B Drive south and take a right. It's right there on the corner, really. A nice, fairly new sleep center there. And I wanted to ask you about daylight saving time.
Yes, sir.
And, we spring forward and fall back, spring forward and fall back. And usually every spring I grumble and grouse. And some people say, well, it doesn't make any difference. Does it?
It does. It does in a lot of different ways, economically, politically, and as far as health goes. So the intention of daylight savings time was to add some more daylight at the end of the day, for personal use. In Europe, it was supposed to save on the cost of candles burning at night, which is the saving part of it. But it really nowadays doesn't translate into any economical savings. It creates a major hassle in our society in that, some states go on saving time, some don't. If you're in the middle of your shift and you get an extra hour or lose an hour, that's a problem. The bookkeeping of changing times is a little difficult. So there's a huge investment that we have in maintaining this system. Some would say it's worth it. Some would say it's not.
What we've been saying is that our own personal experience is the first day it seems a little weird, but it's really by the third or fourth day after we spring forward that we start to feel something. Are we crazy, or is that true?
Well, so the loss of an hour is generally felt more. People can be sluggish for even up to a couple of weeks to fully adapt. Most of us adapt in a few days. But studies have shown that there's some health effects, stress-related effects, and mood effects. The health effects are that the likelihood of getting a heart attack is increased in the first few days after the spring change by about 10%.
Oh, my.
Which is a big leap. The mood effects we can see in the increased suicide rates in the first 2 weeks after that. And then we also have some problems with alertness. The car accident rate goes up. After a few weeks, people tend to settle in and they're okay. They're adjusted. But it can be a substantial hump for people to get over the first few days. That's kind of a lot of evidence to present to kind of offset whatever they have in the pro column, because I don't think we're burning that many candles these days. And I think that electronically, I can't see a case for much savings. Are you a proponent of doing away with the time change? Yeah, well, from a health perspective, it probably is a good idea. From an economic, political perspective, it's far more complex. So we have countries across the world that do this, in Asia and Europe and Africa, and then we would be somewhat out of sync with them. It would affect commerce and banking and some other things. So I'm not an expert in that, but I do know that some states in the United States seriously look at it in the legislative arena about eliminating the savings time.
And there are winners and losers on both sides of the coin when you talk economically or business. When I was a kid, I worked at the drive-in movie theater as a projectionist. Uh-huh. And the business basically was killed. And I asked the owner, so what happened? And he said, well, it was two things. One was the advent of smaller vehicles
compact cars, more economy cars, and people weren't as comfortable sitting in those for 4 hours at the drive-in movie theater. The big thing, though, was daylight saving time because the movie wouldn't start till 10:30 at night. Anybody who goes to the fireworks on the 4th of July knows that. You have those little kids staying up half the night because you can't fire them off until dark. But then there are other businesses that benefit on the other side of it.
Well, and so some would say, yeah, but it feels so good when you switch back and get that extra hour.
Right.
You can sleep in. Studies have shown that very few people actually do sleep more when they shift back, that the extra amount of time that they spend asleep is maybe a few minutes, 10 minutes, 12 minutes. It's not an hour. So it doesn't really affect the total amount of sleep time. You take a big hit when you go to spring and lose that hour, but you don't recover it coming back fully. So we are sleep deprived, and we don't get that bonus gift of that extra hour in terms of extra sleep in fall.
I read some stuff recently about hours of sleep needed. And I wanted to ask you about it since it's been in the news lately. And also since I get 4.5 to 5 hours a night most of the time and maybe 6 or 7 on the weekend. And then I'm reading that an adult my age is supposed to get 8 hours of sleep. Am I putting myself at risk?
That's a tough question. So if you look at the averages, the healthiest people get about 7 to 8 hours of sleep. Now, that is looking at trends over their lifetime. The people who sleep more tend to live longer. But there are individual differences. There are some people who do very well with 5 hours sleep and some who need 9. I think one of the surprising things is that compared to a little more than 100 years ago, when detailed surveys started on this, we sleep far less. We sleep maybe about 6.5 hours. Now, it used to be 8.5 hours back around 1870, 1880, and the human being has not really updated itself from a biological perspective that much. So we're just getting by with less sleep now. And so are our kids. Here's a startling fact. A 16, 17-year-old does function better mentally with about 9.3 hours sleep on average. Almost no teens get that routinely. So we are functioning pretty well with less sleep. We're not at 100% of our potential. That's the trade-off.
Dr. Mark Goetting, Bronson Sleep Health. Thanks for joining us today. We enjoyed chatting with you. WBCK Battle Creek, it's 34 degrees at 9 o'clock.
I'm Dave Anthony, Fox News. President Trump is going to order some Russians to leave. Fox